I want to think about the next 10 minutes as a pause in the busyness of the forum to learn about and truly take in what it means to be a person who does not get the health care he or she should be getting simply because of who they are. Think about what we heard from the Powerhouse Talk and conversation yesterday with Denise Smith. Today, we hear from Kellan Baker. Kellan is a research scholar at the Bloomberg School of Public Health. His life's work has focused on equality for the LGBTQ community, and he currently serves as the chair of the Equality Foundation. Kellan, my pleasure to introduce you. The virtual stage is all yours.
Thank you, Jackie. In the midst of a global pandemic, it's hard not to think about dying. I want to be cremated after I die, not because of cost or convenience, but because I don't trust anyone to treat my body with respect. I'm a transgender man. That means I'm a man who is assigned female at birth, and my body records the experience of medical gender affirmation, which for me included bilateral chest reconstruction, hysterectomy, and hormone therapy. Getting this care in the first place was hard enough. I actually started hormone therapy when I was working in Moscow. I had to volunteer as a research subject for the Russian Institute of Endocrinology, but really navigating gender affirmation in Russia wasn't any more difficult than it would have been in the United States. The message from doctors anywhere at the time was clear. We don't know what to do with you, and we won't help you. That was in 2005. Since then, a great deal has changed in the legal and social status of transgender people in the United States. But in healthcare, the basic problem remains the same. Most doctors and other healthcare providers don't feel like they understand the lives of transgender people, and too many don't care to try. I don't trust providers to treat me or my body with respect. Not after being told by multiple doctors that they don't see, quote, people like me for hormone therapy prescription, which is the same medication that non-transgender people get all the time. Not after hearing that I would have to come after hours to my appointment so that I wouldn't upset the women in the waiting room of the local fertility practice, which was the only place I could find a physician willing to write me a prescription. Not after quitting a physical therapy practice, when the therapist who was supposed to be treating my hip injury groped me to try to figure out whether I was really a man. I'm one of the lucky ones. I've never been physically assaulted in a healthcare setting. I can usually get a foot in the door before it can be slammed in my face. Much of the harassment is whispered behind my back, which makes it impossible to confront, but also easier to let slide. I mostly had health insurance coverage, which frequently didn't cover any gender-affirming care, but at least it meant I could get acute care if I needed it. I'm white and a man, and I grew up with two parents who both work in healthcare. I know how to draw on my privilege when navigating healthcare settings, and I don't trust anyone I meet there. For transgender people who are Black or from other communities of color, who are women or non-binary, who don't have health insurance coverage or the ability to just walk out the door on a doctor who's mistreated them, healthcare isn't just unpleasant, it can be a nightmare. Take the story of Tyra Hunter. Tyra was a Black transgender woman in Washington, D.C. She was injured in a car crash one day on her way to work as a hairdresser. When D.C. paramedics discovered that Tyra was transgender, they stopped treating her and began to ridicule her as passersby begged them to help. Tyra arrived at the emergency room with a tension hemopneumothorax that slowly killed her as she lay unattended, bleeding and struggling to breathe. A medical expert at the wrongful death lawsuit brought by her mother against the city and the hospital testified that Tyra would have had an 85% chance of survival if she had received proper and timely medical care. Transgender communities are close-knit. We try to take care of each other with referrals to doctors who will help rather than hurt us. We do everything we can to take care of ourselves and each other because we know we can't count on the healthcare system But we can't always take care of ourselves. We can be in an accident, like Tyra. We can lack health insurance coverage and not have any other options to get the care we need. As a community struggling with high rates of unemployment and poverty, we can see an already meager safety net being shredded by a global pandemic. The virus might not discriminate, but people sure do. Repairing the breaches of trust between transgender people and healthcare providers will take many changes to policy and practice. But first, it needs to start with providers recognizing our humanity, my humanity, and taking seriously the responsibility to treat us as human beings. Thank you.
Kellan, thank you for that extraordinary candor and for letting us see into a world that many of us don't know all that much about. Thank you. We all know that the administration recently rolled back regulations intended to protect transgender in the healthcare setting from discrimination. Do you feel like there are enough other protections already existing to still do the job?
I think it's important to know that although the Trump administration has changed the regulations, they can't change the law. The Affordable Care Act still prohibits discrimination in healthcare and health insurance coverage on the basis of sex, which the Supreme Court recently said very strongly includes gender identity as well as sexual orientation. So 1557, the Affordable Care Act, Section 1557, that provides these protections is still in place. And so that's an important protection for transgender people nationwide. There are also state laws in about half of the states that provide protections in public accommodations, which sometimes, though not always, includes doctors' offices and health insurance. So there is a little bit of a legal patchwork, but there are still some protections out there that try to make sure that these things aren't happening to transgender people.
Towards the end of your talk, you made a plea for doctors to see your humanity. What does that mean? What do you recommend for this audience?
A couple of things come to mind. One is to think about where transgender people fit in the scope of your practice. So I mentioned that I was having difficulty finding a provider who would write me a script for hormone therapy, because there's this perception that transgender people and transgender health, it's somehow extra or weird or needs to be referred to a specialist. Hormone therapy can actually be managed in primary care settings. Figuring out where your scope of practice includes transgender people and making efforts to provide that care, make that care available, is one really good way. Another thing that comes to mind is cultural competency training. So I know there are a lot of competing priorities, and everybody's, continuing education is something that we all have to work hard to stay on top of. But taking opportunities for training on the cultural and clinical competency in the care of transgender people, not just for providers themselves, but for the office staff, the receptionist, for example, is another important thing to do to make sure that you're treating transgender people well and with respect. And the last thing I would say is collecting data. There's a requirement in the Meaningful Use program that all certified electronic medical records have the ability to collect structured data on gender identity and sexual orientation. So making sure that that's turned on, making sure that those data are being collected, making sure that the forms in the office are inclusive of the proper name, the proper pronoun, and then making sure that that data is actually used to inform practice and to improve the quality of care and outcomes for transgender people.
You said in your talk something that is shocking and sad to hear. You don't trust anyone you meet in the healthcare setting. Would the steps you just outlined increase that trust, even a kernel of it?
Mistrust is really happening for transgender people and for other communities that have historically been marginalized or experiencing disparities and barriers to care. Mistrust really operates on two levels. One is the interpersonal level, the decision that any given person is making about whether they believe that they're going to get good care in this healthcare encounter. And that's really, specific to each individual person and really depends on the experiences they've had before. But the other level is this broader level of systemic mistrust, systemic fear, particularly now in the media climate when you hear so much being said from the highest offices in the land, sometimes demonizing transgender people. There is an epidemic of violence against transgender people right now, particularly Black transgender women, of whom more than 20 have been murdered already this year. So the systemic climate of fear and mistrust for transgender people is unfortunately very live in the United States right now. And it's so important to be having conversations like this. I think the work that you all are doing to identify these barriers to care and identify the root causes of mistrust so that it can be fixed at a systemic level.
We had a question from the audience that I'll paraphrase, and that is, have you ever had the experience of a positive health encounter? And if so, is there something to be pulled out of that and used as an example for other healthcare professionals?
Definitely. There was, I have encountered a number of excellent providers. In many cases, they were nurse practitioners who, for whatever reason, had an easier time relating to me as a transgender person, had an easier time understanding that I have knowledge about my healthcare and working with me as a partner. One of those nurse practitioners was actually a transgender woman, and that was amazing. The first time I'd ever met a transgender woman, a transgender person who was in the provider role and who really just got it, so making sure that pipelines for medical professions include and are open and welcoming for transgender people and LGBTQ people broadly is something that I think is really important. And the last thing I would say is there are standards, expert standards in the field of transgender health. They're maintained by the World Professional Association for Transgender Health. And when I went to my current primary care provider, who is an MD, she had a giant binder of all of the information that she could find on working with transgender people. Because as I said, I do have a lot of information about my own health. I'm kind of a nerd, right? I work in health, I know a lot. But it's also really exhausting to have to teach providers, this is who I am, this is what I need. Mm-hmm. So going into her office and seeing that she had that information and she had been working hard to educate herself as a primary care provider who was going to be working with transgender patients to provide hormone therapy was really, really a wonderful thing to see.